This video is going to help you learn something really important: how to help save a life. If someone stops breathing or collapses, knowing what to do can make all the difference. Don't worry, we will break it down step by step, and by the end, you'll know exactly how to help in an emergency. The aim of this video is to provide you with information about adult basic life support, BLS, and the use of an automated external defibrillator, AED. This will include an explanation of how to help someone who is choking, an introduction to the basic life support process, show you how to open the airway, check for breathing, and perform cardiopulmonary resuscitation, CPR. It will also introduce the use of automatic external defibrillators, AEDs, and show you how to put someone into the recovery position. Choking. What should you do? Imagine someone is eating and suddenly they start choking. Scary, right? But don't panic. Here's what to do. If they're coughing, that's actually a good sign. It means they're trying to clear the blockage. Encourage them to keep coughing. Don't try to stick your fingers in their mouth. It can make things worse. If they can't cough, it's time to act. 1. Give 5 strong back blows. Hit between their shoulder blades with the palm of your hand. 2. If that doesn't work, try 5 abdominal thrusts. Stand behind them, wrap your arms around their belly, and pull in and up. If they still can't breathe, call 999 and keep trying the back blows and thrusts. If they collapse, start CPR. We'll learn about that next. Basic life support. The simple steps to help someone. Remember these 5 key steps. D is for danger. R is for response. A is for airway. B is for breathing. C is for circulation. Let's look at each one of these steps in more detail. Danger. Check you feel safe to approach and do not put yourself in danger. If it is not safe to approach, call 999 and wait for help to arrive. Response. Check if the person is unconscious by shaking and shouting at the person. Give them a command like, "Open your eyes," and shout for help if other people are nearby. You will need to leave the person to get help if no one else is around. Airway. It is important to try and open the person's airway. You can do this by holding the top of their head with one hand, and with the other hand, tilt the head back and lift the chin up. Breathing. Look at the person from arm's length to see if their chest is rising and falling. If the person is not breathing normally, call 999. How to give hands-only CPR. Get them on a firm, flat surface. Kneel beside them and place your hands in the middle of their chest. Lock your fingers together and push down hard and fast, about 5 to 6 centimeters deep, at a speed of 100 to 120 pushes per minute. Think of the song Staying Alive. Keep going until help arrives or you're too tired to continue. If someone else is there, take turns so you don't get exhausted. What's an AED and how does it help? An AED, automated external defibrillator, is a machine that can shock the heart back into rhythm. Sounds complicated? Don't worry, it's actually really easy to use. If someone is unresponsive and not breathing, call 999 and start CPR. The emergency operator will tell you where to find an AED nearby. When you get the AED, just turn it on. It would talk you through what to do. You can't hurt anyone with an AED. It only gives a shock if it's needed. Continue with CPR until the emergency services arrive. The recovery position for someone who's breathing but unconscious. If someone is breathing normally but not waking up, here is how to put them in the recovery position. Lay them on their back and kneel down next to them. Move their arm closest to you so it's at a right angle. Put their other hand against their cheek. Bend their farthest knee and gently roll them onto their side. Keep checking their breathing and call 999. Here are the answers to some of the common questions asked about CPR. How long do I CPR for? Until emergency services arrive, the person starts breathing, or you're too tired to continue. If someone else is available, take turns. Do I need to remove their clothes for CPR? Unfastening a thick coat will help, but you don't need to remove thin clothing. Clothing does need to be removed to attach a defibrillator. Can I injure someone doing CPR? Yes, sometimes. But saving their life is more important than a broken rib. Is it better to press too hard or too soft when giving CPR? Press harder rather than softer. Aiming to press down 1/3 of the chest depth or 5 to 6 centimeters. Soft compressions won't be effective. What if they have a pacemaker? You can still use an AED, just avoid placing the pads on top of the pacemaker. That's it. You now know the basics of saving a life. Hopefully, you'll never have to use these skills, but if you do, you'll be ready. All videos have been developed by the North West Coast Cardiac Clinical Network and partners. Videos are available covering the following topics: adult basic life support, cardiovascular risk factors, coronary heart disease and how the heart works, healthy eating, mental health and well-being, physical activity and exercise, understanding your medicines. Videos are also available in the following languages: Arabic, British Sign Language, Cantonese, Polish, Romanian, Russian, Urdu.